Immunisations are currently the most significant disease prevention intervention and have been for over 200 years. They are responsible for reducing and limiting the spread of communicable and life-threatening diseases that can cause hospitalisations, severe health complications, and in many circumstances death. Since the introduction of childhood vaccinations in Australia in 1932, vaccine-preventable mortalities have dropped 99%. Currently in Australia, the childhood vaccination rate is very high, with over 90% of children aged between 2 and 5 being fully immunised against vaccine-preventable diseases. It is extremely important that this trend continues in order to prevent the return in high prevalence of diseases such as the measles, which before vaccines were introduced, caused the deaths of hundreds of thousands of children and adults alike. So what about those who cannot get vaccinated? In some circumstances, there are many children amongst our population who are unable to receive the vaccinations required to prevent particular diseases. Allergies is one of the most significant reasons for one not being able to receive the necessary vaccination, placing the individual at risk of disease. For certain vaccinations, for example the anthrax vaccine, people presenting with Guillain-Barré syndrome are recommended not to receive the vaccine due to possible severe complications, and thus outlines the importance of maintaining a high vaccination rate amongst the rest of the population in order to reduce transmission. In taking another point of view of this topic, not only does having certain disabilities or illnesses prevent children from receiving vaccinations, but it is becoming a common occurrence for parents not to vaccinate their children due to the belief that vaccines cause disabilities. This belief was generated in 1998 when researcher and doctor Andrew Wakefield published the article with the conclusion that the MMR vaccine severely affected brain development, and thus giving evidence to the theory that the vaccination causes autism. This theory was later disproved and has been determined that vaccinations have no correlation with autism. So how does stigma impact on childhood vaccination programs? With many parents choosing to not vaccinate their children due to the belief that vaccinations do more harm than good, there is a great threat to our high vaccination rate. If the overall rate of childhood vaccinations reduced significantly due to this action, there could be an increased risk of the return of diseases that we as a nation worked so hard to eliminate in the past. Vaccine-preventable illnesses such as influenza, hepatitis A and B, measles, mumps and rubella could very well return and cause dramatic consequences to our population. In order to overcome this stigma and reduce the belief that vaccinations can cause autism, awareness needs to be generated and sufficient education needs to continue. The importance of vaccinations needs to be understood by all in order to achieve a high population health status and to reduce the mortalities from vaccine-preventable diseases.